Mr. and Mrs. McLovin. My name's Michelle. I'm your nurse. This is my student nurse, Susan.
Hi, nice to meet you.
You're so cute.
Oh, thanks.
We just have a few more things to do before you're ready to go home, okay? Susan has some information for you.
So today we're going to be going over transfer techniques. So you'll be going to be using a wheelchair. And some of the information that we have for you is wheelchair safety. And then we have a maintenance schedule. So daily, there'll be something that you'll need to do daily, weekly, monthly, and annually. It sounds like
that's
a lot. It does sound like a lot.
But
well,
you'll take that home, right?
Right.
Okay.
You'll be able to take this home. A couple of the highlights on this information, you can read the details later, is that anytime you use the wheelchair before you get in or out of the wheelchair, you want to make sure the brakes are locked. And then if you get out much, do you like to go out much?
Oh yeah, we party hard.
So
we might be old.
but you're young at heart.
Absolutely.
When you go out, you want to just keep in mind to watch the casters on the wheelchair. That's the small wheels. And if they're fluttering a lot, then you'll want to get those replaced and fixed. But at this point, it's in good condition and you'll be set.
What's the weight limit?
Oh, I think it's about 220 pounds.
So she'll be able to be in there with me. Hubba. Honey, you're making me blush.
Some other information, and anytime we teach patients to transfer, we like to just remind them of just things to keep in mind to reduce their fall risk. So you are at a risk for falls with having one side of your leg, or one leg weaker than the other. So this is good reading material to keep in mind. And when you have the home health nurse come into your house and the home PT, they'll do an environmental assessment of your home safety. Something else I have for you is Lifeline. Have you heard about Lifeline?
Help! I'm falling! Can you get up?
That's exactly the same Lifeline.
I'm not that old yet.
No, you're not. But your wife is in great shape, but she is pretty thin. And as you get older, if you were to fall, it would be hard. Do you think you could get him off?
Oh, no.
Yeah, so you want to have something in place just in case.
Well, I guess.
And then I have some reading materials. Do you like to read?
He doesn't read. He's a typical male.
Oh.
I like it when she reads to me.
Oh, well, that's good. It's something you could do together. One of the things is just there are 7 million people living after having a stroke. And one of the things you could do is read a little bit about how to avoid this from happening again. And then this is some information for you as the caregiver of just some helpful
Hold on, I
hints.
can't see. Darn age. Oh, okay.
Okay, so
Thank you.
take your time, and that's a little reading material. And then lastly, like I said, there are lots of people out there who are in a similar shape as you and facing the same kinds of stressors and new experiences. And so one of the things we found for you is the Evergreen Wellness Center Stroke Support Group. And it's for caregivers and for people who have gone through having the stroke and are living beyond that. And it just is a way to know that maybe you don't feel like you need it now, but sometimes hearing about what other people go through helps. And if you get to the point where you want to talk about it, there are other people who can relate to what you're going through and get some new ideas, a new network for you.
Have you been there?
I haven't been there yet, but that's one of the things on our clinical that we've been asked to do is to go out and try some, just to be able to visit and get to know what these support groups are like in person.
I was just wondering if there were any good-looking ladies there.
Honey! You've got a little hottie right here.
True. Well, I'm a man. Could help it. I got lots of love to give.
Oh, honey.
I'm sorry. You're gonna make me cry.
it's always good to have a positive attitude and some
You know
happiness in life.
You better be.
All
What
right,
has
now
it
that
been,
you
like
guys,
50 years? Sorry. What has it been, like 50 years?
Yeah. Pretty close.
all right, you guys ready to try the transfer?
Are you ready? I'm not doing it. She is.
I'm going to show you how to do it, and then you're going to demonstrate it before you guys leave to make sure that we know that you're going to be able to do it.
Let's get her done.
First thing we're going to do, make sure that the bed is locked. Susan, can you go check that side for me,
yes.
please? Thank you. Bed is locked over here. Make sure the wheelchair is locked as well. Then we're going to move you over to the side of the bed. Move this leg first.
That's my bad leg. I can't move it.
I know, so I'm going to move it for you. Can you
Oh.
swing that one around at all?
Okay.
Okay. And let's pull you up toward the front of the bed. Can you scooch up on your own at all?
This hand's good.
That hand's good? Okay.
It gets off of exercise.
Put the weight
I've been doing
belts
those
on
little
you.
lazy
The
ball
squeeze
things.
balls. Okay. Lift this hand up.
Have you done this before?
Yes, I have.
Have you done this before?
Yes, I have.
And when you do it, you want to make sure you don't wrap it around twice, so you know the one that you're grabbing is the one that has weight bearing on it.
Okay.
So then you can just pull this one up.
Don't be dropping me on my rear now.
Okay. Now we're going to put your,
I can help you.
oh, thank you. I just don't want you to trip on that. And then we'll put this leg back and this leg forward. Make sure the weak leg is always back. And do you want to put your hands on my shoulder, or do you think you can help push off?
I can help you.
Okay. Now what we're going to do is when you count to 3, we're going to lift you up and then just place you over in the chair, okay? So whenever you're ready, you start the count.
1, 2, 3.
There you go. And then we can put your leg belts down. You can,
See,
That
honey,
wasn't so
aren't you
bad.
glad I bought you those non-slip socks?
they're pretty sexy. All right, so do you want to show it to us? Now, would you like to demonstrate that for us?
Sure.
Okay, now I'm going to move you back over the bed, and I'm going to have your wife move you from the bed to the wheelchair, okay?
Okay.
So we always need to make sure that we put the footrest up. And again, just scooch forward just a little bit. Make sure your feet are on the floor, solid. There you go. And then we'll put your weak leg back, your strong leg forward so that we can pivot with that. And then on your count of 3,
1, 2, 3.
there you go. Let's scoot the bed back just a little bit. Perfect. You ready to try it?
I think so.
Okay, we're right here, so.
Okay. I want to put your hands on my shoulders.
And make sure he moves to the front of the bed.
Scoot forward.
With both feet on the floor.
Okay, now put this foot back. And this
Weak
one
leg back,
forward.
dominant one forward, good.
1.
And make sure that you're using your knees, not your back so much.
Oh, okay.
And
So like
pull
this?
pull this foot back. There you go.
And
Yeah,
the wider stance you have, the more center of gravity you have. So widen your stance a little bit. There you
All
go.
right. Ready?
1, 2, 3.
Oh,
That wasn't
good.
so bad.
Very good.
Good job.
Hey! Whoa!
That's right.
Does this mean we can go home now? I have a few more things for you to do first.
Okay.
Now we have to make sure you can get him back in the bed.
Oh, well, can we go to the cafeteria first?
Sure.
Okay.
See you later.
Yippee! Whee!
Hello, Mr. and Mrs. McLovin. How are you feeling today?
I've been better.
You've been better. All right, you guys ready to go home?